Hi, and welcome back to Omni Dish in Garden City. I am Dan York, and as we promised up front, Monica Fulton is with us. She is with the Family Resource Center here in Garden City. Welcome back to the program.
Thank you.
Specifically today, we're going to talk about, and I want to make sure I say all of this correctly, the Healthy Kids, Healthy Community Initiative and the task force that was set up here in Garden City to reach out to kids who are either not insured or underinsured with health insurance. Is that a correct statement?
Yes, the task force was developed to plan an outreach program to reach out to those particular kids.
Okay. Let's talk about the task force itself. Who is on the task force? How did they get there?
The city manager and I sat down and created a list of possible individuals to invite that represented, all of the different parts of our community. So we have business representatives, John Campbell from McDonald's, Mike Farron from Prestige Eyewear. We have a church representative, Pastor Wayne Parker from Mayor Monroe Baptist Church. Of course, our major partners, Garden City Public Schools and Garden City Hospital, both Dr. Shotka and Catherine Chamberlain have been integral in this process since day one. And we have representatives from Wayne Metro Action Agency. And we also have members from our civic organizations, Kiwanis and Rotary, as well.
All right, and I should say in the spirit of full disclosure, I also serve on this committee helping with public relations, communications, marketing, that sort of thing.
That's right.
So let's go back to the beginning. A grant was available to do a study. Is that a fair statement?
Yes. The very first phase of this three-phase process was a leadership academy opportunity. And an email came across my desk last summer, and it was from the National League of Cities, and they were looking to do an initiative. They started an initiative called Cities Enhancing Health Access for Children and Families. And they selected 20 communities from around the nation to come to this leadership academy to learn about how cities can help their residents access health care. So Garden City was one of those 20 communities that were selected for that Leadership Academy.
So already that was actually a fairly large accomplishment just to be selected for this Leadership Academy.
Absolutely. In fact, when I wrote the grant, I was not at all sure that we would get it. I figured that it would be something to try. We'd be lucky if we got it. It was a fairly simple application, so it didn't take up too much of my time, and I thought, well, what the heck? I knew that working with the families in the Family Resource Center, I knew that some of our families were struggling to get health coverage and access to doctors and mental health care. So I knew that we had some kind of a need. So that's kind of what sparked my interest in even pursuing it. Okay. So yes, 20 communities and it was available to every city in the nation.
Okay. So out of X amount of cities that possibly applied, we made the first cut of 20.
Right. Yes. Mm-hmm.
All right, and then we get into this 20-person or this 20-city group in D.C. What happens there?
So we went to Baltimore actually for a 3-day intensive training about the issue, about the amount of uninsured children across the nation, and what other cities have done to help get their residents covered with health insurance. And then out of those 20 cities, the 20 of us wrote another grant for a planning phase.
Okay.
So of the 20, 12 communities were chosen to continue on into phase 2 and develop and plan for an outreach campaign and an enrollment campaign to get as many children and families covered with health insurance as possible.
And Garden City made the cut to that.
Yep.
All right.
One of the 12.
Okay, so and we are probably the second smallest, we think, city that made this group, but it's cities like what? Jacksonville, Houston, Dallas.
Mm-hmm. Yep, and Columbia, Pennsylvania, Aurora, Colorado, Hattiesburg, Mississippi. So yeah, we are, I think, one of the smallest, communities.
So really, I know you won't say it, but that's a credit to you and your grant writing skills that we made it this far.
Well, thank you, but I always have to say that our town makes it easy to write these grants because of the way that we are structured and the way that all of the community members work together. So it just involves connecting all the pieces in a way that makes sense to the reader.
Okay, so Garden City qualifies for this planning phase. What does that mean?
So what that meant was we received $28,000 to conduct an assessment of the community in regards to our uninsured, and to develop a business plan for an outreach campaign that will then become the grant application for the implementation phase, the last phase of the project with National League of Cities.
Okay. And so the major part of this was the survey that was done, correct?
Yes, the survey that we did was specifically designed to try to get a firm number of how many of our children were uninsured but eligible for low-cost or no-cost health insurance programs in our state. Okay. We had an idea. We could do some math based on uninsured rates in the state and poverty levels in the state, but we didn't really know what specifically the extent of the problem was in Garden City.
And the group of people that you put together, a lot of them had access to these numbers coming from different areas. So you were able to put all that information together and put together a rough number, but there was no way to validate it.
Exactly. So what we hoped the survey would do was either give us information that said what we started with was wrong and this is what we need, or that it validated our initial estimates. Okay. And so the survey did exactly that. It validated what we originally thought was our issues.
Okay. Now, I want to get to the results of that survey in a second, but since then, too, you've gone back to Washington along with a couple of other communities to be recognized and to speak to the process that we went through to get where we are right now. Is that correct?
That's correct. So all of the 12 communities involved in the planning phase had to attend what National League of Cities called a cross-site meeting. Okay. And it was more training and more information. During that 3-day training, National League of Cities invited Garden City, Houston, and Jacksonville to speak about innovative practices that we've engaged in through this planning phase.
And what were some of those innovative practices?
So one of the innovations was that the community sent out a personalized letter to each of the key stakeholders in the community, inviting them to be a part of the planning phase. Another community brought together all of the health insurance providers for their state's insurance program, and working through those providers to develop an implementation project. Garden City, they wanted Garden City to specifically talk about the online survey that we conducted and the use of social media, Facebook and Twitter and the city's website in partnership with the school district's website and those kinds of things. And so they were really excited about the survey. And we, I think it was Pittsburgh, Pennsylvania, actually asked to partner with our team during a breakout session to learn about how we did the survey and why we chose the questions that we did and how we pushed it out to the community to get the awareness and the level of response that we got.
And I don't want to gloss over this, and I hate to go to these, but of all the cities involved in this, Dallas and Houston and Jacksonville and Omaha, Nebraska, Pittsburgh, Providence, Rhode Island, Savannah, Georgia, Aurora, Colorado, I don't know if I'm repeating any of them, Hattiesburg, Mississippi, and New Bedford, Mass. Garden City was, out of all of those larger cities, Garden City was selected to present on this subject.
Yes, so that we were one of the 3 communities on the panel of innovative practices alongside Jacksonville and Houston.
That's a pretty big deal.
Yeah.
That's a pretty big deal. Whether you want to play that up or not, that's a pretty big deal.
Right, and the other thing that came out of that, the National League of Cities, right before the cross-site meeting, the National League of Cities was holding their National Congressional Cities Conference. And so the people that I work with through this healthcare initiative invited me to come early and speak at that national conference about what we're working on here in Garden City.
Okay.
In conjunction with a representative from the Annie E. Casey Foundation, who did his entire career in San Antonio, Texas, helping residents access federal benefits and things like that. So that was another big deal for me personally, to be speaking to over 50 city officials from across the nation about what we're doing in Garden City.
Well, good for you. It's very well deserved.
Thank you.
Before we get into this, the entire point here, because we've thrown out a lot of technical terms and a lot of buzzwords, but the main thing is to get every kid with some form of health insurance in our community.
Yes.
I mean, that's the end result here, no matter how we get to it, no matter what all of the rest of this is. The whole point is to get the X amount of kids in Garden City that are either underinsured or not insured at all on some form of health insurance.
That's right.
Whether it be free, low cost, or traditional, the way people are used to it, although there is no norm anymore with the Affordable Care Act.
Right.
But get them insured, get them healthy, get them safe.
Yes.
I mean, that's the bottom line.
Absolutely.
Okay. All right. So let's talk about this survey. This is going to be available on the city's website, www.gardencitymi.org, and this will be on the homepage because we want to get this information out to folks to basically get us to the next step.
That's right.
Let's talk about this survey.
Okay. So we had 120 families complete the online survey, which was a fantastic return rate. National League of Cities was very impressed with that. I know our task force felt a little disappointed that there weren't more. However, the people that responded to the survey are an exact representation of our community at large.
Okay.
So
the demographics of our community?
Yep, it matches our demographics exactly.
Okay.
So we can be very confident that the results can be extrapolated to the community at large.
Okay.
Yep. So what we found was overall, it looks like about 10% of our children in Garden City are not insured but eligible for low-cost or no-cost insurance in Michigan.
Okay. All right, so 10% breaks out to about how many kids do we think?
We think about 600.
Okay. So a significant number, but also a manageable number.
Yes.
Okay. All right. So that's your target, or our target, is these 600 kids and their families.
That's correct.
Okay. And what do we do with that information now?
Well, the other part of the survey was about the barriers. What is keeping families from enrolling in these types of health insurance programs within the state? And so we were able to identify 8 barriers, and we were able to rank order them, put them as number 1 through 8. And the number one, the barrier most often selected was the fact that people were hesitant to work with the Department of Human Services, the DHS office. Right. So recognizing that as a barrier, the task force is working on developing a project so that we overcome that barrier.
Okay.
So we're looking at running a city-led project where actual city staff is involved in helping families enroll and work through the application process.
Okay. And when we talk about the Department of Health and Human Services, help me out with that. As someone who's never had any contact with anything like this, what does that mean?
The Department of Human Services does a lot of social benefit programs. So things like the Medicaid and children's health insurance programs, food assistance, those kinds of things. And they can be, the offices can be very crowded. Workers are very overwhelmed with caseloads. And so there's just some inherent barriers. And
this is a state-level department?
State-level department, yeah.
Okay. Oh, so the primary objection or barrier, if you will, to people getting the health insurance they need for their kids is that department.
Is just working with that department in Garden City specifically. So this is the great thing about the survey. We're able to identify specifically in Garden City what the barriers are. It doesn't represent barriers in other communities necessarily, but right here in town we know what we're up against.
But specifically, we're only looking to address our own community anyway.
That's right. And so the number 2 barrier was that families don't believe they're eligible for these programs. So that tells us that there's a lack of awareness about how much income you can have and still be eligible for these low cost or no cost insurance programs.
Sure.
And so part of the task force's program will involve educating, bringing the awareness to the community about the income levels that exist and still being eligible for these programs.
Okay.
The number 3 barrier was not knowing how to apply.
Okay.
So the task force is looking at providing what we're calling application assisters, somebody to sit down with the family and work with them on a tablet type of a situation to complete the online application. People just simply don't know how to even go about it, where to find it, where to do it, where to complete it, how to complete it, what documents do we need, those kinds of things. So those are the kind of the top 3 barriers that the task force is really working to overcome, so that we can get as many of our children covered as possible.
And on the chart that we showed, almost all of those barriers are in the 80% range and above.
Yes. In fact, all but one is in the 80% range or above. 50% of the respondents said a barrier is that people already have insurance.
Sure.
So that was the lowest. The lowest.
And there were other questions in the survey and other categories that were deemed to be irrelevant or not important to what we're trying to do here.
Or
not as important.
Not as important, but also cross-validating. So not knowing how to apply and then missing the paperwork that's needed kind of go hand in hand.
Sure.
They don't know all the things that are required. Another important aspect in Garden City is that people don't want to ask for help in town. We're very prideful. Our community. We are, pull us up by the bootstraps and get moving kind of people. And so asking for help is a barrier. So we want to make it as easy as possible to be out in the community, to be a part of everyday language, everyday life, and just be out there just helping people so they don't have to seek us out and find us and have to go through the process of asking.
And the great thing about this, let me back up one step. A term that you have used regarding the people that are on the committee is you had a certain amount of quote-unquote naysayers by design. Mm-hmm. And I want people to understand that was not, the game wasn't rigged going in.
Right.
That you had people on this committee, me being one of them, who you wanted to poke holes in this.
Yes.
Who you wanted to say, we don't think this is true, or we don't think this is the right approach, or we question whether or not this needs to be done. So this has gone through the smell test, if you will.
Yes.
Through folks on this group. So It's not just people that are involved with this every day, that to them this is normal.
Right.
There were also people on this, like me, who have had no exposure to this ever in their entire lives. So we poked holes in this, and that helped make this hopefully a stronger survey and a stronger document.
Absolutely.
Based on that, though, the one thing that I got out of it was that having worked with the city for 30 years and having grown up in Metro Detroit, you become leery of the county. You become leery of the state. Mm-hmm. You don't trust these agencies because you've seen mismanagement. You've seen layers and layers of bureaucracy. Mm-hmm. You've seen something that just doesn't seem to be very welcoming to you. Mm-hmm. The nice thing about this is this tailors this to Garden City. This breaks this down to Garden City, and this is going to be Garden City people reaching out to Garden City people.
Yes, and that is the beauty of it, and that is what the National League of Cities is trying to do. Cities are recognized as trusted entities, and city staff, across the nation, there's been studies done, and city staff are seen as trusted people, and community centers are safe places. So, having a city-led project and right in our hometown, tailored to our needs, is exactly what the National League of Cities is looking to do.
Okay. Where do we go from here? I know now you have a big job ahead of you, which is putting together the next phase of this to try to receive the larger grant to implement this plan, correct?
That is correct. So all of the work that the task force has been doing these past 4 months is now, I've got all the pieces, and I just now have to write the business plan, the grant application, if you will, and submit it to the National League of Cities by May 30th.
Okay.
The grant is for a maximum of $260,000 for a period of 18 months, and it is designed to do community outreach, education and awareness, as well as the actual enrollment process and getting children enrolled. So we have goals, we have objectives, and I have to get that all down into a nice package for the National League of Cities.
Also, let me point one other thing out. This is not government money that's doing this.
That's right. It is so unique, and it's been a great experience for me because I have historically all these years been working with federal or state level grants or county grants. This is actually money from the Atlantic Philanthropies. And Atlantic
Worst name ever for a philanthropic group, by the way, but go ahead.
It was founded by the man who started the duty-free America shops that are in all of the airports. Yes.
All right.
And so it's his philanthropic organization, and they are charged with spending all the money. So they are that organization is working themselves out of a job. But so they partnered with the National League of Cities. One of the primary goals for the Atlantic Philanthropies is all children covered. All children having access to health care. So this was a perfect initiative for National League of Cities to do nationwide.
And this overall grant was over $3 million to get this thing started, right?
Right, to the National League of Cities. They ran the Leadership Academy, which was all the travel and food and everything was no cost to the city. The planning grants to each of the communities, plus all the travel to the cross-site meetings, that was no cost to the cities. So all of that money, is covering all this entire project. For the National League of Cities, it's a 3-year grant process for them.
Okay, very good. Mm-hmm. If we qualify, or if we're selected, I guess, we're going to go down from 12 possibly to 6 cities.
That's correct. They're anticipating that they'll fund 6 cities of the 12, and they did let us know that they are looking to fund a wide variety of cities. So they're not looking just to fund the big cities, but also the smaller cities and towns. So that was good to hear. That was refreshing. I know lots of people that I've come across like, but what chance do we really have? And actually, we have a very good chance.
What chance did we have to get down to the 12, really, if you think about it?
Exactly.
And the fact that you've been invited to Washington to speak to these groups, and the fact that this survey and the way we went about it has received recognition from the National League of Cities and from the folks involved with this, that actually bodes pretty well.
Right. The team feels that way. The leadership team is made up of myself, our city manager, Bob Mary, Stan Shotka from Garden City Schools, and Catherine Chamberlain at the hospital. And Catherine actually was the one that traveled with me to the cross-site meeting, and she got a really good feeling about, our chances, and it's just been a really great journey.
Okay. So by May 30th, you submit the grant.
Yes.
When do we hear back?
Well, they hope to let us know by the end of June. Okay. So, end of June, early July, we should know.
But then the real work starts.
Then the real work starts, that's for sure. Yes, yes.
And this will be a significant undertaking. This is not, this has been, a little bit of effort to this point, but not very much, at least for me. A lot for you. This is going to be quite an undertaking once it gets started.
Yes, and the grant will cover additional staffing to do the implementation, to coordinate the day-to-day things. I anticipate that I'll be heavily involved in the oversight, the laying of the foundation, the getting it off the ground, the being there in the beginning, just every step of the way. Yeah. And then support staff will be involved. And, we have a lot of commitment already from members of the Kiwanis Club. And actually, the Parks and Rec Commission, I forgot to mention, is also part of the task force. And one of the commissioners is very interested in being a volunteer to help families enroll. We have a really big, volunteer base in Garden City. We always have. When we talked about sustainability with the National League of Cities, they weren't getting that volunteers can sustain this going forward after the grant money. They didn't have a real good idea of what life is like here in Garden City. So
and there's a good example of they kind of live in a bureaucracy where things are done a certain way. Mm-hmm. And folks, if you ever went out east, man, it is a whole different place. They don't think like we do at all.
Right.
And you're right. To the idea that volunteers can do this, and if you look at Garden City and what the volunteers do in Garden City, it's pretty amazing, anyways.
Right, absolutely. I mean, to have GCYAA celebrating 60 years and a lot of the key people being there for 10, 20 years is unheard of. It's unheard of. And so they really encouraged me from the National League of Cities to really talk about how Garden City's volunteerism holds this community together.
Very good. All right. Well, then, good luck.
Thank you.
Good luck to you and good luck to us, I guess, and the entire community. We'll have you back to talk about this more as more information becomes available.
Sounds great.
All right. Again, go to www.gardencitymi.org to look at the survey and the results and for more information. Monica Fulton, thank you very much.
Thank you.
All right. We'll wrap up Omni Edition Garden City right after you watch this.